Hello, my name is Terri Summers. I'm a physical therapist at Henry County Medical Center Home Health. I wanted to talk to you today about what you can expect when you receive home health services after returning home from your joint replacement surgery. Once we receive an order or referral from your physician for home health services, both a registered nurse and a physical therapist will come to your home to do an admission assessment. The nurse will perform a complete medical assessment, including your surgical incision, heart and lungs, and she will review your medications. The nurse then works closely with your physician to confirm all your current medications and establish a plan of care to address any current medical issues and to prevent complications after surgery. The nurse may also recognize other pertinent health conditions that would benefit from routine monitoring by our nursing staff. One of the main benefits of receiving home health nursing is that you and your caregivers will receive teaching that will give you a better understanding of your medications and disease processes, along with signs and symptoms of complications that would interfere with your recovery. This knowledge helps to eliminate both anxiety and confusion that often comes after a surgery and a hospital stay. The physical therapist will also perform a complete assessment to determine where you are with your hip or knee rehab program. This is important so you can have a smooth transition from the hospital or rehab to home health therapy. If you are doing well moving around in the hospital and you have someone that can help you at home with your daily needs, you would do fine coming home from the hospital to continue your rehab. But if you have decided to go to rehab after the hospital stay and are then coming home, home health is still beneficial in assisting you with resuming your daily activities specific to your home, as well as continuing with your joint rehab. Home health therapy not only addresses your total joint therapy, but also provides teaching and practice with performing normal daily self-care and household activities. We will teach you to be safe with your mobility in your home and work with you to learn the safest way to enter and exit your home. This may include stair training with your steps and handrails if you have them. Also, learning how to manage your door while trying to get in or out with a walker can be quite tricky, especially reaching back to close the door behind you. Another task that home health therapy helps teach is dressing. Getting dressed is not just about being able to reach your feet to put your clothes on, but also safely gathering your clothes from closets and drawers while walking with a walker without losing your balance. We will teach you the best way to manage all of these activities. Toilet and shower transfers in your home may be different now that you've had a joint replacement. So we not only provide you practical training, but also advise you about equipment that would make those bathroom tasks easier and safer. After a new joint, stepping into the shower or standing up from the toilet to pull up your pants can challenge your balance more than you ever thought possible. Now, let's move on to the kitchen. There are certain obstacles that you encounter with preparing something to eat. We will work with you on how to safely carry items from the counter, refrigerator, or microwave to the dining table while still using your cane or walker. At first, someone may need to help you with those kitchen tasks until your strength and balance has improved enough to walk and carry something, like that morning cup of coffee. Now that we have talked about how home health therapy assists you in safely resuming some of your household tasks, I want you to know that we've not forgotten about that new total joint. As we continue with your total joint program, we work with you on increasing the joint range of motion as well as strengthening of the muscles around your new joint. We want that new joint to work for you so you can get back to living life. Your daily task and your walking ability will improve as your joint range of motion and strength improves. We will also work with you to regain balance and help you safely transition from the walker to a cane to no assistive device. We guide you through this progression as your body is ready. So what about the equipment needs for home health therapy? You will already have your walker or cane as well as the CPM if you had a knee replaced. We will bring in the weights and resistance bands as needed. Then everything else we use are common household items like plastic shopping bags, towels, pillows, and a bed. We will have you sit or lie on a bed for some of your exercises. If you've had a knee joint replaced and have a CPM machine, the therapist will make sure that the machine fits you properly by making necessary adjustments on the very first time that we see you. Now let's talk about pain for a few minutes. As you know, by now you can expect to have some pain after surgery. We believe that pain control is very important. We will monitor your pain throughout each therapy session. This way we can make adjustments to keep your pain at a tolerable level. One thing to help control your pain is to use your pain medicine as prescribed. Also, applying cold pack around the new joint can help reduce both pain and swelling. Another important thing to remember is that your new joint will get stiff very quickly. So moving around frequently really helps to reduce the stiffness and also the pain that goes along with the stiffness. Anxiety and the fear of pain can sometimes be more limiting than pain itself. So use your pain management tools and try to relax as we guide you through your total joint rehab. So just to recap, home health is here to get you back to moving around in your home and mastering your specific obstacles while we continue with your joint rehab program. And that is all within the privacy and the convenience of your own home. So when you are doing so well with your mobility that you no longer need assistance to get ready and leave your home, you will be ready for the next phase of your rehab, which is outpatient therapy. Your outpatient therapy needs can be taken care of by Henry County Medical Center's Center for Wellness and Rehabilitation. Our goal with home health services at Henry County Medical Center is to help you to return to your max level of independence and make your joint replacement surgery a great success. Remember, there is no place like home when you're going through your joint replacement recovery. Thank you for your time and thank you for choosing Henry County Medical Center for your healthcare needs.